Welcome to the Business of Wellness. I'm your host, Jaclyn London. Last week, all eyes were on Robert F. Kennedy Jr.'s confirmation hearings, where major questions about public health, nutrition policy, and government accountability took center stage. While much of the debate focused on vaccines and broader healthcare issues, there's been almost zero discussion about the biggest driver of chronic disease in America, our food system. Despite it all, there's no meaningful, real policy suggestions or solutions that have been proposed that could actually improve America's nutrition landscape without extreme overregulation or federal overreach. And the amazing thing is that when the topic of nutrition came up during the Senate hearings, most of RFK Jr.'s suggested or proposed ideas for making America healthy were strategies that would actually require implementation and regulatory oversight by the USDA, which of course is not the agency to which he's being nominated. That's why today I wanted to talk to you about the real, actual policies that I think could make a profound difference in the declining health trajectory of our country. So if I were in charge of America's nutrition policy, here are 5 things that I would implement as a registered dietitian that would actually make Americans healthier while also garnering bipartisan support. These are going to be realistic, they're impactful, and they're achievable policies that align public health goals with economic growth, consumer choice, and free market innovation. Specifically, I'm going to get into integrating nutrition education into schools through cooking classes, the Gus Schumacher Nutrition Incentive Program, and what could be done through this existing federal program to improve access to fresh produce and deepen our relationships with regional cuisine, local farmers, and small businesses. I'll also talk to you about corporate incentives to reduce added sugar, saturated fat, and sodium in restaurant meals and food service, reevaluating marketing claims on food products, and specifically under the Department of Health and Human Services, getting preventative nutrition counseling by a registered dietitian covered by insurance. Before we dive in, I would absolutely love to hear from you. I would love for you to share this episode with someone who cares about public health, who's curious about MAHA, who wants to learn more about food, nutrition, and health. Feel free to share this episode far and wide. It only grows with your continued support, and that means sharing it and any engagement on the post that you are able to provide. So if you feel like leaving a 5-star rating, if you want to leave a review, I would absolutely love to hear from you, and I welcome and encourage your questions. I also am really eager to hear from people who disagree with me. So for the MAHA moms out there who are going to disagree inevitably with some of what's talked about today, please feel free to reach out either wherever you're listening to this podcast right now, and of course on social media at Jaclyn London RD. I'd also love for you to follow the show so that you don't miss an episode at the Business of Wellness wherever you're listening to this. And again, find me at Jaclyn London RD. All right, let's dive in. Here are 5 ways to make America healthy again. Let's bring cooking classes to schools. The average American child has little to no formal education in basic cooking skills or nutrition literacy. And I see adults, I work primarily with adults. So seeing the lack of nutrition and health literacy in real time, in real life, is something that could be very difficult to undo and is certainly not something that I have any interest in forcing anyone to do if that's not a priority for them. So the only way to really make meaningful change here, I think, is to focus on the next generation, is to focus on children. School cafeterias often serve ultra-processed meals, and fast food consumption is at an all-time high among American youth, right? And there's nothing wrong. And Kennedy actually mentioned this in his hearing, is that he was like, I'm not here to take away foods from anyone, which I think it was an important thing for him to say. However, I think focusing on the wrong things could get us into some truly hot water. And primarily relying on ultra-processed packaged foods, as these foods tend to be stable on shelves for longer, meaning they can be transported, they can be shipped all across the country very easily, I think is failing us. It's failing our health, and it is also not getting us in touch with our own local agriculture, our own communities, which could be so impactful for our health on so many levels, right? It's not just about physical health. It's also about mental health and building a sense of community, and also ending the loneliness epidemic that I feel like so many of American youth have been battling. Because kids often grow up in a more disconnected environment, an environment that's disconnected from food. Because kids are growing up disconnected from food, they're relying on convenience over nourishment. And this is to the detriment of health, right? I also think that more than ever, we have been talking about and thinking about ways to integrate STEM programming into school. Why not use cooking as a way of doing that? Cooking is STEM. It's all science. It's all about science, right? And it's certainly about technology, education, and math. All of that goes into cooking and baking. And of course, STEAM also, I feel like people now want to talk about STEM and STEAM. Okay, STEAM would be the arts component. There's definitely a lot of arts when it comes to cooking, right? I mean, not so much, I think, if you're related to me and I've cooked for you, not so much in some of the stuff that I cook, but that's only a visual thing. I mean, it tastes delicious, but I have yet to master making things perfectly aesthetic and visually appealing. All right. Anyway, I digress. Mandatory hands-on cooking classes in public schools in ways that are integrated into STEM curriculum as a blend of science, math, and practical life skills is invaluable. If we were to do this and to garner bipartisan support for this, getting federal and state funding through the Department of Education and through the USDA could make this accessible at the federal level. But I do believe that doing this on a statewide level and incentivizing states, delivering budget to states to actualize this within the realities of your communities is that much more impactful. And this also gets back to something that we talked about quite a bit in the last episode, which is the lack of food culture in the United States. We do have a food culture, and I do want to be careful about how I say this because we do have a food culture. It's just that our food culture is not prioritizing the same things that European food culture does. Again, we have prioritized things like efficiency, innovation, speed, the ability to provide surplus to Americans and abroad, to countries abroad, right? So that we can feed the world. We have prioritized many things above the experience of eating food, the experience of growing our food, of staying connected to our environment, integrating parts of the food supply chain into daily life and understanding where our food actually comes from. We have prioritized many things, and that has created a culture in and of itself around food. We've certainly prioritized convenience, and that alone means a lot as it relates to food culture. But if we really wanted to create culture that has health as a priority, that prioritizes health first and foremost, then doing that, bringing us closer to the people that produce our food and bringing our children closer to the people that produce our food is the single most important step that we can take to get there. Partnering with chefs, farmers, local businesses to make nutrition education really engaging and fun. There's this like old adage in nutrition that is the way that we speak about it now, which is if you make it, you eat it, right? And that I think that tends to be true for kids and adults. But when it comes to kids love being involved in the process, in every step of the process or any step of the process, right? So the extent that we can get our kids involved in making food with us, in picking out new ingredients, in shopping for food, in prepping food, in cleaning up after we eat, although that one's going to be a little bit trickier. I haven't quite gotten there with my 1-year-old yet. We're still on the making a big mess phase of life. This works. This can work. Healthier habits start early. Kids who learn how to cook make better food choices for life. Anyone who knows how to cook is automatically making better food choices for life. Hands-on learning also boosts confidence. It builds self-efficacy, and it reduces that reliance on ultra-processed packaged foods because you therefore have the skills to be able to make something for yourself that is simple, that is not, quote unquote diet, but is also not the most convenient thing that you've ever consumed and therefore can sit on the shelf or sit in a vending machine for months at a time. It also is supporting our local communities by supporting agriculture. And this is a necessity. Where I think this is back to what I was saying about food culture, I think this is really where we have power to truly build that culture from literally the ground up, because we do have different specialties that are unique to different parts of the country. We're just not talking about that in the public health context, right? Like, that you go to the South, you can get grits. And that you go to Maine and you're maybe going to have a lobster salad sandwich. Lobster salad sandwich, yeah. Maybe you're going to have lobster salad. Maybe you're going to just have lobster. Maybe you'll have some steamers. I don't know. That's kind of making my mouth water as I talk, right? You're going to go to Southern California, you'll have Mexican food. There's lots of different things that we are eating in different areas of the country that are specialties to that region and specific to the local agriculture and to the communities around them. This is something that we need to instill more and celebrate more on a more local level, because it really comes back to where you live, right? And I say this all the time. And if you read my book, Dressing on the Side, if you have not read my book, please buy it. It's called Dressing on the Side and Other Diet Myths Debunked. Where you are when you make decisions about food is ultimately the only thing that matters in real life. If you really want to build habits that stick for real life, you have to think about where you spend time. Without that, you're making choices for a different person's reality, right? So if you want to make choices for your own reality, you need to think about where you are when you make decisions about food, where you are when you eat, and what you're doing later in the day. And that can be applied at a broader scale on a public health education level. We can support local agriculture by thinking about our own communities, who needs our help, what are the things that we want to do to support our local agricultural crops, how can we make these foods more a part of our everyday lives? And that is going to start in school. I also feel like not knowing how to cook can really be a disadvantage. And I have personally felt this myself. I did not grow up knowing how to cook. And by the way, my mom is going to listen to this and, cringe as she's hearing this, probably driving while listening to me say this right now. So hopefully she's staying safe. That is, I don't feel badly about that at all. I was diagnosed in my 20s with celiac disease. And that is what caused this revolution for me to become interested in food in the first place. Because when you really are pushed and you have to make food for yourself, you really have no other choice, right, than to learn how to cook. For me, it's not really about cooking necessarily, although I absolutely love cooking and I really love baking too. And I have come around to both of these things at different points in life and found that there really is something special when it comes to building self-efficacy around food. It really makes you feel like I can do anything when you can master a recipe or when you can, come up with your own idea for what you want to eat and actually execute it. But it's also about organizing. It's also just about organizing food, organizing meals, putting meals together. If you don't know the right food combos of flavors of things that you already like, if you don't know what you might like based on things that you've tried before, if you don't know that you don't like spinach, but you do like broccoli, and therefore you do like vegetables, right? Like you do like some vegetables, right? If you haven't experimented with it because you don't know different ways to prepare things, then that puts you at a real disadvantage when it comes to taking care of your health. Because I think we get caught up in this whole very elusive meditating on a lotus leaf, Gwyneth Paltrow-y version of cooking, when what I'm really talking about is the ability to prepare meals and snacks for yourself. I said before, I mentioned the bringing chefs into these programs. There's programs like this around the country. Wellness in the Schools is one that I've worked with. That's an amazing program. I hope I'm saying that and they're still around or still an amazing program, but TBD, we'll check in on that later. We'll circle back. We'll circle back with them. But I bring this up because I think it's important to mention that it doesn't have to just be about this beautiful version of a chef prepared meal. It can literally just be the things that you have on hand that are whole foods. Whole grain brown rice, beans, cheese, is it pasta, right? Like there's lots of different staples that you can have around that you can just basically cobble together a delicious meal, including frozen veggies that you have on hand, the canned vegetables that you have on hand. I just used canned artichokes in something the other day. This is the type of thing that I would like to see more of when it comes to programming, because I think that we have made this somewhat a subconscious decision to make these recipes and to make the programming around cooking in school something very aspirational rather than attainable. We need to get to something more attainable here. It's mission critical. Anyway, that's where I'm at. That would be the first one. Can we get federal funding to be deployed to states from the USDA and Department of Education to help cultivate STEM programs in public schools for school-age kids? This could make a huge impact on American health. Number 2, cut waste in the Farm Bill and boost fresh food incentives. Farm Bill spends billions on outdated subsidies, propping up commodity crops like corn, soy, and wheat, ingredients that dominate ultra-processed foods. And programs like Gus Schumacher Nutrition Incentive Program, this exists. This is an already in existence bipartisan program that can help lower the cost of fruits and veggies for low-income families. And it is actually underfunded, which is rare for me to say something at the federal level is underfunded. But I truly think that this one is. And it's not getting enough attention in the current climate around ingredients we need to ban. And, everything is killing us. And Kennedy is going to overhaul everything about our food system, even though he only is going to control the Department of Health and not the Department of Agriculture. But I digress. The problem is right now that many small farmers struggle to compete with big ag. And that is absolutely true. That limits fresh food availability. So what would I want to do about this instead? I think that we could spend some time reallocating funds in the Farm Bill to cut inefficient subsidies and ultimately increase funding for produce-based incentive programs. This is critical, is to get produce incentivized. in the lives of everyday Americans. Expanding the GUS Nutrition Incentive Program, increasing funding for expanding the GUS Nutrition Incentive Program's reach allows more families to purchase fresh fruits and veggies at a lower price point, at an affordable price point. I have talked about this ad nauseum, and I talk about it in different ways. So forgive me if you have heard this before or if you're sick of me saying this. I just find this statistic continuously staggering. And it really ties into what we were talking about before about the priorities and the focus of the Kennedy testimony that he provided this week, the answers to the question. Would you call that testimony? I don't really know. Of his answers to questions at the hearing this week. When he's talking about the chronic disease epidemic, why are we not talking about things like the fact that 90% of Americans aren't eating enough produce? If you're listening to this, it's very likely you. That's scary, right? Like we know that we already have things in our current food supply that help us, that lead to preventative health. Why are we ignoring this fact? Why are we ignoring the fact that 90% of Americans aren't eating enough produce? I know I can see this being politicized online. I see this getting politicized by a lot of very respectable scientists that I admire very much, but I see them coming at this from the left, and I'm curious about it because I think a lot of the argument here is that, it's because we don't have enough funding. It's because nothing gets enough funding. And that is true. But in order to get funding to go to health specific programs, even if they become state specific programs at the federal level, what Kennedy has done is drive so much awareness around things like food dye, which we all know is just completely ancillary to actual human health. So why can't he use this platform to drive awareness around the fact that 90% of Americans don't meet recommendations for produce? That is something that raises a number of red flags for me, and it does show me something about the industries that may be in his ear. I feel like that is something that I'm just going to keep on holding out hope for and holding out hope that that's not true. But I'm confused about why we don't talk about programs that do exist and what we could do to make them better. How we could, even if this one isn't the right program, even if GUS Nutrition Incentive Program, even if it's not the right program, what would get more produce in the hands of everyday Americans? I think supporting local agriculture, again, it comes back to that for me, through grants for small and mid-sized farms is going to be everything. And I think that this is where our voices really matter. This is where the MAHA movement could be and where it's at its strongest, because I know that there are some within that movement that are speaking about this, and I'd love to see this become more normalized and more a part of the conversation. It's the one around regenerative agriculture as well. Strengthening local economies means supporting small farms instead of industrial agriculture. So if you can buy something locally, it can start there. It also helps to make fresh food more affordable, right? Because it'll help families choose produce over more processed food and choose produce as part of their everyday lives, as part of the meals that they're making to sustain their everyday lives. I also think, ultimately, the one thing we do know, and this is, again, I hesitate to say no, but I do feel like it's where we have a tremendous amount of research, is that eating more produce does, in fact, reduce healthcare costs. Diet-related diseases cost over $1 trillion a year in medical expenses, and having access to fresh, wholesome, nutrient-dense, fiber-rich, antioxidant and mineral-filled vegetables and fruit is basically the only thing that we would really need to do in order to protect the health of everyday Americans. I come back to this point, and I feel like I have to reiterate it again. Why is RFK not saying that? A huge criticism that I have had of him is the ties to the supplement industry. So if you are being told that you're not going to get these nutrients that you need that are underconsumed from veggies and fruit, but you are going to be told that you should be getting them from supplements, I have a real problem with that. Supplements are not safe. They are unregulated. I do not see a deregulatory administration like the Trump administration suddenly deciding to regulate dietary supplements. So we have access to things that we need. We have access to the preventative medicine that we need in the form of produce. We're not tapping into it enough, and we're not talking about it enough, and we're not driving public awareness around it in a way that is satisfactory to make and cultivate meaningful change. Number 3, let's tighten marketing rules for food and drinks aimed at kids. When it comes to ultra-processed packaged foods, the marketing of it all is perhaps where I take the biggest issue. And I say this because if we want to promote the free market and allow products to exist to be bought and sold on the free market. To Kennedy's point, I want you to have the Big Mac or keep the Big Mac and the Diet Coke. I just want you to know what's in them. I don't think that we can do that without real reform around what's allowed versus what is not allowed on food products and packaging and how marketing is currently allowed to target, to advertise to kids. 80% of food marketing targeting kids is for ultra-processed packaged foods and high sugar products, right? So the food industry spends billions on ads strategically designed to influence kids' preferences. And there's very minimal regulations that are actually protecting kids from misleading food claims. There's also, might I say, very misleading claims on food, period. And I think that's where a lot of the problems come from. Again, I can't force an adult to learn about nutrition if they don't want to, and I have no intention of promoting any ideas like that, right? But I do think that it is a fascinating thing to see how many adults do not know the first thing about food products and about food packaging. Let me give you one of my favorite examples about this: veggie straws. I'm not a fan. Now, there are other dietitians out there that are going to tell you, oh, it's fine, stop beating yourself up over eating veggie straws. And I'm not here to blame the consumer about the veggie straws. I am looking at the producers of those veggie straws. Now, potatoes are vegetables. Let's not make any mistakes here. Potatoes are vegetables. But potato starch should not be the first ingredient in a product that's marketing itself as, colorful fruits and veggies are in here. There are different types of the veggie straws are like green, yellow, and orangey, I think. Green, yellow, and orange. And they're made from mostly potato starch and potato flour with just some powder mixed in of spinach powder, yellow, I don't even know what yellow is. It yellow tomato? Is it squash? I don't know. My point being that they are nutritionally the exact same as potato chips. In fact, they're higher in sodium than potato chips. And that is a level of lack of transparency that I take issue with. Because I think that parents genuinely believe they are doing the right thing when they buy the veggie chips over the potato chips. And I'm not so sure it's doing much. I see people talking about this as a better for you choice versus potato chips, but if they're nutritionally the same, say for the sodium, which is higher, then they're really not getting much by way of veggies. They're really just getting potatoes. Again, I come back to potatoes are veggies, but then you might as well have just gone with the potato, right? Then why not just buy the potato and know what you're getting? And that's really what bugs me about the lack of transparency in our food system, is that we are targeting parents sometimes as a way to target kids. This needs to end. I think something that we could be so much stronger about is revising the current legislation, the current rules around food marketing, and making it very clear to consumers who do not have formal nutrition education what's what in the grocery store. You look at some of the food claims, and if I just take my dietitian hat off and I just look at something like, I always give this example of the Go Macro bar, which drives me absolutely up a wall because I think there is no better picture of quote unquote wellness from a bar that has where the first ingredient is sugar. It's a candy bar. There are some candy bars that don't even have sugar as the first ingredient. They have chocolate as the first ingredient, and then it's sugar right after that, right? So to me, this is an egregious miss and an egregious oversight that we are not paying enough attention to. We need to do something about the current state of marketing. We need to do something about the way that certain claims are defined. But I have very little faith in this because when I look at the FDA and their entire circle jerk, I apologize, but I don't. Their entire circle jerk about the term healthy and redefining the word healthy on food labels. Honestly, grow up. Come to a definition, make it simple, stop overcomplicating it. There's no reason that it should be hundreds of pages long, and get it in the hands of the American people. Enough with the stakeholders. Just get a group of scientists together, make sure that they disclose their financials as every scientist needs to, and then just come to a simple definition. And I think the definition of healthy as it relates to food products should be things that have a first ingredient that is a whole food. A recognizable food. Doesn't have to be non-GMO. It doesn't have to refer to the farming system or practice. It literally just has to be a food. That should be the criteria. Is it a food? Great. Okay, that's it. See, maybe even, and I hate even using this term, but maybe we should restrict it enough that healthy on food labels can only mean things in the grocery store that are just the commodity product. That would make it easy, right? Let's just simplify this. Make it simpler. I know that there's people that are going to give me pushback on this statement, but I just think we are missing the forest from the trees. And it's happening with the response to the current state of chronic disease, but it's also happening within the scientific community as well. We have way overcomplicated these things. There's too many stakeholders involved in these decisions, and we need to cut back, make it simpler, make it easier for everyday people to just eat more nutritious food more often and to feel empowered to do so, right? Because you know that where I'm coming from here is from a standpoint of we need to teach people how to fish as well. Not literally, although that would be nice. But we can't just tell people what to do. We need to teach them how to do it in the future. So if we can do that on food labels in a meaningful way by passing some legislation that actually helps us reform how we are targeting the parents of children who are eating these foods, I think that that would really go a long way. I also think that we need to do something about the Disney and the cartoon characters and all of that. This is something that I have seen banned in other countries that is allowed in the United States that I actually think would be meaningful. Maybe, I don't know. As I'm saying that, I'm like, does Tony the Tiger have that much influence? You know what I mean? Like I'm saying this and I'm like, all right, yeah, but is he how much of an influencer is Tony? I digress because I still think marketing is a huge deal. I just mean when it comes to cartoon characters, I'm not so sure how powerful that is, but I'll get back to that in just a sec. I think we need to update the FDA and the FTC guidelines to restrict misleading health claims on kids' products. But I also really believe that some of these cartoon characters and Tony the Tiger-ish influencers are just being misused. Why not? Why can't we put Tony the Tiger on celery sticks or radish slices or cut pineapple or, some of the dehydrated fruit snacks that are out there, like dehydrated strawberries, right? Wouldn't that make a lot of sense? Why couldn't he be associated with something that brings the produce to people or the more convenient, more nutrient-dense foods to American households rather than being associated with sugar-sweetened cereal? I like that much more. I feel like he could just have much more positive influence that way. Don't you think? I also think that anything that is a kid-friendly product has to meet a certain basic standard of nutritional quality. And I think we could spend a lot of time defining what that is, but for the sake of getting us, of keeping us moving here, I think like if we can do something that prioritizes simpler cooking methods, playing with different flavors, experimenting with different flavors, but keeping it a little simpler and, not feeling the need to batter and deep fry everything that goes to kids. Kids don't naturally need to love the chicken tender. Like they can like grilled chicken too. I don't see why we're not making that statement more of a front and center offering and more of a front and center kind of topic of interest in 2025. Bring the simple preparation methods to the kids. That also will really help all of us get more involved in getting our kids to learn how to cook, because the simpler it is for us, the simpler it is for them to actually do and for us to actually do with them. I think ultimately, long term, this will protect children from manipulative advertising because they will learn about what actually goes into food. And it encourages food brands to reformulate for better nutrition. If you want to put your toucan on the stupid packaging, then you're going to have to reformulate and go from Fruit Loops to like strawberry flakes, dehydrated. So I don't know why. I just used them in a recipe the other day, dehydrated strawberry. I don't know why I'm stuck on this for now, but I think that would be a really meaningful place to start. Parents, also, this puts you in the driver's seat again. It helps you regain control over food choices, over things that are coming into your house without the interference of industry, because you don't have to worry that your kid is looking at the thing with the toucan on it that was cereal and now is dehydrated strawberries that you're putting in your cart. In that case, that would be a great thing. That would be a great thing. I do want to say one other thing on this topic, which is that I just think that the partnership innovation that is happening in the produce aisle is really something special, and that other whole food commodity industries could really take note of this. I spoke with folks from, my God, I like that it's just left my brain. It's a tomato company. Nature Sweet. I did a podcast episode for the produce moms with Nature Sweet about tomatoes and about a new partnership that they were launching with Paw Patrol. This is brilliant. To me, this is the pinnacle of brilliance when it comes to leveraging fun, engaging, and kid-friendly things, like the things that kids really love that really brings them joy, and bringing them to different parts of the supermarket. Things other than sugar-sweetened cereal and Pop-Tarts. This is the future of our country. This is our family's future. It's so meaningful to see kids get more engaged and more excited about something that is as delicious in its own right as cherry tomatoes, poppable cherry tomatoes that make for the perfect snack. This is an ideal way to align the fun that we associate with some of these kind of, high sticker price, really splashy marketing campaigns with actual community growers, farmers, the people who produce food for our country. I can't think of anything smarter than that. So I just wanted to shout that one out as an example of people who are doing this right. I want to see more partnerships like that in the produce industry in 2025 and beyond. Our next topic, number 4, motivate brands. Number 4, incentivize brands to cut back on sugar, fat, and sodium by 2030. The current problem that we have is that most restaurant meals specifically, as well as ultra-processed foods, of course. But when I think about the incentives that could really have impact here, most of ultra-processed packaged foods and restaurant meals contain excess added sugar, saturated fat, and sodium. Brands and corporations, they're not going to change unless they're incentivized to do so. We have seen some of these incentives and suggestions about incentives. And again, back to the circle jerking over incentives around the I was about to say Make America Healthy again. No, around the Let's Move campaign. There was a lot of that happening with Partnership for Healthier America. There were a lot of things happening there that just was basically like a way to say that you were doing something better for people without actually doing very much. So there's that. We can get into that another time. But I did have a front and center seat for that one because at the time I was nutrition director at Good Housekeeping, and we had the media partnership with Partnership for Healthier America. So we were kind of covering all things related to the Let's Move campaign and their alliance with Partnership for Healthier America and how they brought in brands, to make commitments. And I just remember being at this event in 2015 and being like, what is even this event about? It's just like this huge, enormous event in DC, and it was basically about getting kids to eat healthier. But like, I still don't really know how. It's like, and brands would get up there and be like, "We're gonna make Americans healthier." It literally just kind of reminds me of what's happening right now, but with same exact ideas, but just one was right and one was left, and neither one is actually helpful. So there's that. Okay, small anecdote. We just went down that rabbit hole for a sec. Anyway, brands have quietly started to reformulate. Okay, so this is already happening, and I have used this example before, but it is a powerful one. Taco Bell, for example, has been reducing the amount of sodium in their menu items since 2008, and they plan to reduce it even further by 25% by 2025. I just want to say that, for the amount of time that we've spent talking about transparency, and not just me, I mean, for the amount of time that I feel like people in the MAHA sphere and RFK and also those of us health practitioners and people who work within the food industry in different ways, we spend a lot of time focused on transparency, and transparency is absolutely everything until it sometimes is not. And I say that because when people ask me, if you were to say as a dietitian, what do you think is the healthiest fast food? Taco Bell is universally the number one that comes to mind. And I say that because, first of all, they have a dietitian leading a lot of their innovation, someone I have met before whose name is escaping me, even though I would love to call her out. And I feel like because of their commitment to reducing sodium, but because they are also known as a fun, quote unquote, brand, they're also known as a place that is their marketing capital is based around their brand of being less healthy. Right? They don't like to talk about the initiatives that they've taken to actually meaningfully improve their food offerings. There's a lot going on there. It makes you wonder, what would they have more success? Would they be more profitable? Should they be more profitable by telling Americans that they actually have been reducing sodium in their menu items all of this time? Since 2008, this started. They've been reducing sodium gradually, and therefore they're making meaningful, that's really important. That's a really important change that is just not going to be obvious to everyday Americans. Because if you do something gradually like this, we know we have plenty of data that show that this is way more impactful in retaining customers while also making your products healthier. To me, that's really meaningful. It really shows that this can be done and that there is a strategy for doing so. My question for you guys, for those of you listening right now, is that marketable in 2025? And I mean that very earnestly, because I would normally be of the faith that it has historically not been marketable. It's been a very difficult one to do, because when you tell someone that you're making changes, they automatically assume that it doesn't taste good anymore. And in the case of Taco Bell, like taste and flavor and strong flavor and partnerships with folks like Pepsi, like Doritos, that's a huge part of their brand equity and their brand identity. So would this be a driver to tell more people about the fact that they are cutting down on sodium in their menu items? I would love to hear from you guys on that one. Please definitely make sure that you share that by leaving a review, or if you're watching right now on YouTube, definitely share that with me here, because I would really like to know what you think about that. I just wonder, because, I say that like this has historically been the thing of the food industry. However, we also know that things have changed quite a bit. So I do wonder if that would be better received now. And at the very least, it shows you that for the other brands, because certainly Yum brands are not the only folks that are doing this, it shows you that there is a blueprint for success. We can actually incentivize privately held and publicly traded companies to reduce the amount of added sugar, saturated fat, and sodium in their products and in their menu options. And we can do so working with the private sector, easily bipartisan support right there, without forcing people to do things. We can say, you're the expert on your own supply chain. Where can you cut back on these 3 nutrients? Where can you include more veggies in your order? And I do want to make that one last point about Taco Bell here, because I think that's an important one too. By cutting back on sodium, by cutting back on added sugar and saturated fat, you also leave an opportunity to replace those nutrients with customizations that add flavor from fiber-filled ingredients. Taco Bell is the blueprint for that. Fiber-filled ingredients, salsa, guacamole, adding extra fajita veggies. By the way, Chipotle does a great job at this too. There are ways to add and to reframe the conversation around what to eat more of, rather than focusing so much on what to ban or eliminate or restrict. Anyway, so just to recap, let's set voluntary reduction targets for added sugar, saturated fat, and sodium by 2030. Let's offer tax credits to companies who improve product formulations. And I think we should continue to highlight brands that meet these standards and make for a competitive advantage. So like if at the top we have people calling out Taco Bell for reducing their sodium content, I think that would go a long way. It also encourages that gradual reformulation, does not bring the rhetoric back to mandates or bans, and it levels the playing field. It means that brands that invest in healthier products are not going to be disadvantaged by market conditions. And it also ensures consumer choice. And I think above all else, prioritizing consumer choice and doubling down on that message as a part of this is going to be critical. The last topic that I want to talk about today is to make nutrition counseling. The last and arguably the most important topic that I wanted to, the last thing we need to talk about today is make nutrition counseling covered by insurance. Now, here's the current problem. Most Americans cannot afford to see a dietitian. I myself do not accept insurance. Okay. And I share that with you transparently because a huge part of my business is because I share that with you because only a small part of my business is seeing private clients. For the most part, I'm working with brands and working with businesses and consulting in that capacity. So to accept insurance and make more work for myself in terms of that paperwork it's just not a good business strategy for me. But I share that with you because insurance only covers medical nutrition therapy for specific conditions. It does not cover nutrition counseling for prevention. All right, the last topic that we've got to get to today is to make nutrition counseling covered by insurance. All right, most Americans cannot afford to see a registered dietitian in 2025. And this is a problem, right? Because insurance is only going to cover medical nutrition therapy for specific conditions and not for prevention of disease. Nutrition counseling is proven. It is one of the few things that is proven in the world of scientific research to improve long-term health outcomes, and yet access remains incredibly limited, and we are doing nothing to drive awareness around this. And I've got to say, this is one thing I was like, as I was recording the intro, I'm thinking to myself, what is the one thing that I missed? What is the one thing that I really meant to talk about and I didn't, and it's been bothering me this whole time, and this is it. Is that Kennedy was asked very directly about what he would do to improve nutrition-related outcomes, to improve preventative health measures through Medicare and Medicaid. And he had the opportunity to say, get nutrition counseling by a dietitian covered by insurance. And of course, he chose to focus on very broad terms around SNAP and quote unquote ultra processed foods. Okay. So he did not take that layup, and he really could have. And that's something that I think I will certainly be on the lookout for. And it again speaks to the influences that are in his ear about what is actually priority in this space. If we had nutrition counseling for preventative health covered by insurance, it drives tremendous awareness around the role of the RD and what dietitians can actually do to help you. I don't think everyone would take us up on it. I don't think being referred by your MD would mean that everyone is seeking nutrition counseling. I think it would just mean that the people who want it can have it. And therefore, that means of nutrition education, of getting that nutrition education into the hands of everyday Americans and empowering them to make healthier choices wherever they are, at the supermarket, when they're on the road, when they're at the office. We only ensure our own success through meaningful education. This is the opportunity to do that. So, I think this comes back to something that I've talked about so much, which is that it feels very vague and unclear and upsetting and unfortunate that so much of this conversation has become around like how little training doctors get in medical school around nutrition, when doctors should not have nutrition education experience. They should not have nutrition counseling experience. If you're doing surgery on my knee, I really don't want to know your thoughts about protein. I want you to know every single fucking thing about the knee. That's it. Right? I mean, I can't be alone in that, right? That is personally what I would like for you to know about. If I knew, however, with caveat that if I knew that there was a profession out there that was entirely dedicated to providing nutrition counseling for prevention and for the management and treatment of disease. We have a profession that is dedicated to this. Why aren't we using it? Again, red flag that he did not speak about this at all during the hearing, or that even the senators know shit and have zero ability to ask follow-up questions on this topic as well. All right, so why not expand insurance coverage to include preventative nutrition counseling? If big insurance is going to take all our money anyway, and no one's talking about big insurance in all of this, by the way, notice how that works, then why not loop in preventative health counseling for people who are interested in receiving it? We're never going to get public health care. And I personally am not someone who feels like we should have it. We're not Europe. We're built differently. And so we need to take small measures where we can. If we could get this coverage of, let's say, 1 to 3 sessions covered by insurance, I think that would really go a long way. It would truly empower American adults also with what we talked about at the beginning of these 5 things. The first thing about getting kids to learn more about what goes actually into food. We need parents to have some degree of nutrition literacy. So it's not really going to work to help kids meaningfully make healthier choices for the long haul if we don't have parents focused on the right things. And the only way to get parents focused on the right things is not to listen to what Callie Means says is good for your health. It's to listen to the only experts who are trained and educated to provide medical nutrition therapy for prevention and management of disease. However and wherever we can integrate dietitians into primary care teams as a standard of practice in preventative care, I mean, that would require some more primary health care to begin with, but perhaps it's, where can we incorporate dietitians into an interdisciplinary team that is outpatient? Where can we do that in clinics and in settings across the country? I also think we should be incentivizing employers to offer dietitian services as part of their wellness programs. If there is one thing that I could say to your HR department, to your people leader, as they used to say at Weight Watchers, where I work most recently, I feel like that term is just so gross. I don't really know. Your people leader, I don't get it. Anyway, all right, I digress. But I'm not sure why we have ignored that to some degree, right? Because doing this would again take the burden off of federal spending. Incentivizing employers to offer dietitian services as part of wellness programs. Can you imagine? That would be huge. I mean, I remember, speaking of Weight Watchers, I remember a time where it used to be that Weight Watchers meetings would be happening at as part of different employee wellness programs. Why can't we do that with dietitians? Why was that up to a corporation to do that? Why not do that with RDs? I mean, I know the answer to why not do that with them, because, you're not, I rub your back and you rub mine. But I mean, why not actually empower the people who know something, who are trained to deliver realistic scientific information to people about food and nutrition, rather than outsourcing it to a company? I feel like if we actually wanted to make these changes, these are the types of things that we would be focused on, and then we could talk about how to make them profitable. But again, I come back to being afraid about what is coming for us, because I feel like when these things exist and we're not utilizing them, or they're not being named in the conversation about how to actually make Americans healthier, it gives me a tremendous amount of fear. Anyway, here's why I think that this could really work. It's going to lower healthcare costs. We know that. It is proven to lower healthcare costs. Meeting consistently, receiving counseling from a registered dietitian meaningfully lowers healthcare costs by preventing chronic disease before they happen. It also makes expert nutrition advice accessible to all. And I think this comes back to the marketing of the profession. Barely anyone knows what a dietitian is. Most people are calling us nutritionalists in the first place, and that is just a made up word. So I think if we bring the expert nutrition advice front and center and make it more accessible, the better off we are. And the last thing would be to reduce reliance on fad diets and misinformation. Once you're empowered with this info, you can spot bullshit from a mile away. And that would maybe put me out of a job, but I would take it. That would be okay with me. I'm just kidding. There's always going to be misinformation peddlers, right? There's always going to be people that are selling their latest fad and their latest supplement and whatever. I just don't think that the new mainstream thing should be dietary supplements because of the influencers that have infiltrated the Kennedy campaign and therefore his kind of umbrella army of MAHA supporters. In general, I just think that bringing the dietitian into the conversation would just go so far in this whole story around making Americans healthier. It feels weird to know that there is a whole profession that has dedicated their entire existence to doing this, to helping other people do this, and we have not been tapped for our expertise or knowledge on the topic. I don't know. We'll see where this lands. But I mean, getting the profession covered by insurance would be a huge step. And I wish I had heard that at the Senate confirmation hearings this week. All right, before I let you go, let's do a quick recap, okay? Number 1, teach kids to cook early, do it in schools, and deploy funding to states to help kids build lifelong food confidence and confidence in the kitchen. Number 3, regulate marketing to kids so they aren't manipulated into forming unhealthy habits. And let's rethink these partnership opportunities so that marketing to kids comes in the form of produce. Encourage food reformulation to make processed foods healthier without sacrificing taste, and make nutrition counseling accessible to prevent disease before it starts. Those are my top 5 things that could meaningfully make Americans healthier. They are by no means a comprehensive list of everything that we need to do to actually improve health in this country. And I know that my friends who are on the left are going to say, you haven't even touched on food access and social determinants of health. And of course, that's true. And I come back to something that I have mentioned a number of times as we get deeper and deeper into this topic. And we'll certainly do an episode at some point on social determinants of health and food access, because it is, of course, mission critical. But I just feel like MAHA is specifically focused on the food system itself, on what is specifically in our food. And so it made me think about what a list would look like that is specifically addressing those concerns a little bit more and focus in a little bit more on that. I probably should have said that at the beginning, but I think it's worth saying now because it's something to think about. We need to meet people where they are all the time. We always need to meet people where they are, right? And in this case, when it comes to this conversation about and around what is in the food, what are the scary ingredients in our food that are so-called banned in other countries, even though they absolutely are not, we find ourselves needing to address the things that touch on that subject more specifically and really be hard-hitting about it, because otherwise they're winning this argument with us. We just sound like we're deflecting and like we're changing the subject. Anyway, what do you think? What are your thoughts? I really do want to hear from you. Whether you agree with me, disagree with me, where do you stand on this topic in general? What is one of these that you think is brilliant? What is one of these that you think is idiotic? All of it. Just tell me. Leave it in the form of a review. As always, I love spending time with you. I love to hear from you. Feel free to leave any and all thoughts, feelings, questions for me here, wherever you're listening right now. And also find me on social at Jaclyn London RD. Shoot me a message, comment on a post, and I will get back to you. All right. I'm going to leave it here for now. Until next time, thanks for listening.